Welcome to this week's edition of Cardiovascular Updates, covering the latest breakthroughs. Brought to you by LucidQuest, a groundbreaking study in stroke patients reveals that the brain's ability to link vision and language is essential for understanding objects. Damage to the connections between visual and language regions impairs knowledge of object colors. In contrast, stronger connectivity enhances task performance and visual processing in the ventral occipitotemporal cortex. These findings underscore how language shapes sensory experience. Artificial intelligence is now transforming cardiac diagnostics. The MeshHeart model, trained on more than 38,000 heart scans, creates 3D animations of individual heart function. These personalized models allow for earlier and more precise diagnoses by comparing patients' heart mechanics against healthy references. Even the oldest patients can benefit from full medical therapy after a heart attack. New evidence shows that patients age 90 and above who receive guideline-directed medical therapy, including beta blockers, antiplatelets, lipid-lowering agents, and RAAS inhibitors, have improved survival. The message is clear. Age alone should not limit aggressive treatment. A major development in hereditary cardiac disease is underway. The AAT early trial has begun, investigating the drug acoramidis in people carrying transthyretin mutations but showing no symptoms. This could become the first preventive treatment for hereditary ATTR cardiomyopathy, a potentially fatal genetic condition. Artificial intelligence has also shown promise in stroke management. In China, an AI-based clinical decision support system was tested in over 21,000 stroke patients. The results were compelling: lower one-year stroke recurrence, reduced mortality, and improved adherence to treatment protocols. MRI data was integrated for enhanced clinical decisions. In predictive cardiology, researchers have created a hybrid AI model combining gradient boosting, cat boost, and neural networks. This ensemble achieved an AUCR-OC of 0.82 and used SHAP values for explainability. The approach ensures risk predictions are not just accurate, but also interpretable by clinicians. Homocysteine levels have emerged as a potential red flag for heart risk in diabetic patients. A study found significantly elevated homocysteine in diabetic cardiac patients, with a weak but statistically significant correlation to inflammation markers like ESR. These findings suggest the need for targeted screening in high-risk diabetic populations. For patients undergoing stem cell transplants, early cardiovascular complications are more common than previously thought. Data shows that 5.55% of hematopoietic stem cell transplant recipients experienced early cardiovascular events, particularly atrial arrhythmias and heart failure. These events were linked to a six-fold increase in mortality, underscoring the need for heightened monitoring. A new challenge in stroke therapy has come to light. Researchers found high levels of amyloid in thrombi from acute ischemic stroke patients, which helps explain the resistance to standard fibrinolytic treatments like alteplase. This discovery points toward the need for stroke therapies that target amyloid. Finally, a sobering epidemiological trend. Heart disease has surged nearly 150% in Southeast Asia, making it the region's leading cause of death. Contributing factors include high blood pressure, unhealthy diets, pollution, elevated LDL levels, and smoking. In response, the AI-based system Sense is being deployed across hospitals in Singapore to improve diagnostic accuracy and patient outcomes. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare